Welcome back to the Front Page Saturday Town Hall edition. It is our intention to bring you news, information, and updates on the COVID-19 coronavirus. Wait, I just learned it's really SARS coronavirus 2. And, you know, we're so pleased to be partnering with Supervisor Mark Ridley Thomas, the Independent Professionals Association at indiework.org, Community Build, the City of Los Angeles, and Council President Emeritus Herb Wesson Jr. to bring you this news and information every week. So we thank them and we thank you for joining us. You may call us 520-KJLH, 520-5554. Love to hear from you anytime throughout this conversation. We're being joined right now by our supervisor from the 2nd District, Mark Ridley Thomas. Good morning.
Morning to you, Dominique. How are you?
I'm blessed and was so happy to have you. The county has been really on the front lines in this, of pandemic, just in terms of getting information to the people and as well as, providing services.
Well, we're all in, and we're bringing in the extensive resources of the County of Los Angeles, particularly our health institutions, to leverage their investment in terms of outcomes for higher quality services and patient care. We have made it our business to be on the front line with frontline workers. We made it our business to honor essential workers, and we've made it our business to let them know that we are there for and with them. At the Martin Luther King Medical Center, at the Charles R. Drew University of Medicine and Science, tremendous things are going on to care for patients who have been stricken and are suffering as a result of COVID-19. And then the Harvard UCLA Medical Center. These are institutions that are part of the 2nd Supervisorial District, and we are proud of that very fact. But our job is to look ahead and to make sure that we're doing all that we can from a healthcare delivery perspective, from a research perspective, from a medical perspective, to deal with the issue of disproportionate impacts on African American, Latinx communities, all communities, to make sure that we are doing all that we can. But there are a number of challenges out there. And when we think about what we need to do, we need to think about getting ahead on the discussion pertaining to vaccines. What does that entail for our communities? And so I would want to say that developing a vaccine is the first step. The hardest step to follow will be the equitable allocation and distribution of these vaccines. That's where we have to keep this framework of justice, this framework of fairness, this framework that I advanced at the Board of Supervisors in terms of an anti-racist policy-making agenda, so that those who need it get it and are not discriminated against or denied based on their ethnicity or any other difference of that sort. So, the challenges are real, then if I can say so, they're twofold. The whole world is struggling to develop and ramp up production capacity. That's the discussion of the moment. And the initial vaccine supply will be limited. We know that. But the question is, who will get access to it? And this could easily mean an unfair or inequitable allocation of these valuable resources to help people get better or to prevent them from getting sick in the first place. And we want that not to be for the privileged and exclude those who are not considered privileged. And so the second point, I guess, is how do we ensure that there's an equitable distribution of these much-needed issues, these much-needed vaccination scenarios. And I think the public needs to know that communities of color will not be denied. And that's the role of the public sector and the private sector to insist on fairness and public trust. I guess it's fair to say that there's a history of suspicion around this, particularly for African Americans who were forcefully and unethically used as subjects of experimentation and research. And we know all about the Tuskegee experiment that ran literally 4 decades, and it was engineered by the United States Public Health Service. So that starts a degree of trepidation about, can you really trust government? And I think we have to insist on standards, insist on protocols, insist on the consequences of being discriminated against in this way. We do not want more people of color dying as a result of COVID-19, and we have to work hard against it. That's why we need institutions like Drew University of Medicine and Science, who are committed to the underserved, to be in this and on this in a powerful way. I think further, if we are left out, we cannot allow that to go unnoticed. We have to be a part of these clinical trials that make sure that we are in the discussion early and not late. Clinical trials matter, and that's the basis on which disproportionate impacts take off. We've got to be in that. So it's no wonder that according to some of the research that's been done, for example, by the Pew Research Foundation, that only 54% of black adults indicated that they would be willing to take a COVID-19 vaccine if it were available and proven to be effective. There's a lot of fear, there's a lot of distrust, and I have to say this is in contrast to some 74% of white adults who say yes, that they would be willing to participate in those early efforts. And so we've got to get our numbers up across the board. And so Front Page, KJLH Radio Free is doing an indispensably important service by communicating and educating our public about this. We've got to speak, preach, and practice equity. And this coordinated system of care has to be at the front line. We have to insist that the Department of Health Services, the Department of Public Health in the County of Los Angeles are on the case. We've got to step forward, lean in at the state and federal government and insist that we not be an afterthought. And they need to fund our primary institutions who our constituents trust to be message carriers. And so this is all really, really important. And, you know, we need our health plans and our community clinics and community-based organizations and other existing credible institutions, our faith-based institutions that constitute the infrastructure of communication to be on point. They are the trusted message carriers. We got to make sure that they're in the game and they're very forcefully. So trust. Reliable networks of trust. And so I think we have to explicitly move away from the historical model of vaccine development and distribution that discriminates and cause it to empower people in terms of self-care, empower institutions that are indigenous to our communities, that are trusted. And I think we have to outline a strategy in coordination with you, Dominique, with Front Page listeners, the whole network to come forward. Now, There's more to be said about that. I plan to push that forward because prevention matters in a substantial way. But we have health experts in the county of Los Angeles.
Yes, we do.
Who address this. And so I'd like to step aside for a moment and have one of our leading physicians, researchers at the Harvard UCLA Medical Center come forth and speak to those issues. And Dominique, if you'd like to introduce Dr. Daar, you can, and I can, whatever you say.
Let's both do it. Actually, you probably know him better than I do, so I'll defer to you on that. I'm so glad to have Dr. Daar on this morning.
Well, I will just simply say that when we think about leading scientists, clinicians, and the like, we think of Eric S. Daar because of his contribution in the area of HIV and related infectious diseases and the like. A big resume of service and commitment to our populations, knows what the business of immunization and vaccinations is about. And to the extent that that is the case, I thought it would be useful to have him to join us to fill in some of the more research-oriented questions that come before us. And so, Dr. Daar, thank you very much for being with us, and take it away.
Welcome, Dr. Daar.
Hi, thank you so much for having me. I really appreciate the opportunity to be here with you both.
Yeah, and we love having you. There's been a lot of questions. Some of them we didn't get to yet. We're talking about, this pandemic and what the latest science is on it. And for those of us who are, moms and dads and workers that aren't medical experts, it can be very confusing because it seems like the information is constantly changing, and, and what is considered acceptable or safe is constantly changing.
Indeed.
So let's talk about let's talk about this idea that the virus might just disappear or go away. Some people are still hoping for that to occur and maybe burn itself out. Is that something we should be expecting?
Yeah, unfortunately, I think we're well beyond that. There's always uncertainty, and when you talk about sort of things changing along the way, I think we have to understand that that's the nature of a new disease. And this infection, although we've had coronaviruses before, they call it a novel coronavirus for a reason. It's really quite different than anything we've encountered before. So we have been forced to learn about it along the way. And, we're now in the 8th month since the original cases were described in China in the midst of a really heated epidemic here in the United States, but also California and obviously in Los Angeles. It's not going away on its own. I think we have some things we can do to help control it. I think everybody is aware that we have people who are in the community who are potentially infectious. We know that most of the transmission is probably occurring when we come in close contact with those people. Some of those people don't even know they're infected because they're asymptomatic. And the response that has evolved since the beginning as we've learned more is for people to maintain a distance, and we talk about that 6 feet, which is about right for somebody, if you're exposed to someone who's not coughing or sneezing, and for everybody in closer environments to wear masks to reduce the risk of transmission. And this has proven to be extremely effective. The things like stay-at-home orders in the midst of really large transmission within the community, I think was a measure that's necessary. I think we're going to slowly be able to start to come out of this because of people taking increasing precautions. But planning on this going away on its own isn't the answer. So we need to be careful, and we need to be developing strategies to better treat those who are infected, and that's going on, and there have been some advances there. And we need to come up with other strategies for prevention, and that has traditionally been a vaccine in preventing epidemics of viral infections and pandemics. And, now there's progress going on, moving along very quickly on several very promising but not yet proven to be effective vaccines.
Yeah. So you said a lot of things that, people have been asking about on the show over the weeks. One of the things we hear is that there's lots of different strains or versions of this virus, and maybe a vaccine wouldn't even fix all of them. Maybe it would only address one or two, and, that maybe that means that we can never get a handle on this problem.
Yeah, I'd like to be more optimistic than that. I've spent the last 2.5 decades sort of battling the HIV pandemic, where there is truly a lot of variability in the virus, and that has been an enormous obstacle to the development of vaccines. But this virus, although there are some subtle differences, probably not within the area that we're targeting with vaccines. So I think there's reasons to be optimistic, but the reality is, and I think you're alluding to this, we won't know until we do the research.
All right, that's a great point. Now, what about just, you said masks and hand washing, and we keep hearing those things, and 6 feet away, and stay away from people who are coughing, try to stay outside as much as you can. What about when we come in the house? We've heard different things about how long this can live on surfaces and such. So should we be, taking off all our clothes and throwing them in, the hazmat bag and spraying everything down with Lysol? Or, do we need to worry about our shoes? Do we need to go take a shower every time we go out of the house? That kind of stuff. How often do we throw away or wash that mask? I mean, just how careful do we need to be coming from outside to inside?
I think it depends a little bit on your exposure risk. For people who have sort of normal levels of exposure risk, i.e. just hanging out in the community, the likelihood that they're going to be heavily contaminated with the virus is very, very small. And then while it can live on surfaces, I think the data would suggest that, as we've learned from the epidemic, that most of the transmission really is coming from these respiratory droplets. And the media is confusing because they want to share all of the information available. So we're hearing a lot about surfaces. We're hearing a lot about the possibility that the virus may persist in the air for prolonged periods of time. But for most people, it's that immediate contact with droplets that's important. Things on their surfaces, their shoes, their clothes, are not to be concerned. And I think the masks, if you're not heavily exposed to somebody, you can use the same mask for several days. If you have a face covering that's washable, washing it every few days is perfectly appropriate. If you have a disposable one, again, if your exposures are more routine, community-based types of exposures, it's okay to use them for a few days as long as they're clean and they're not moist or soiled.
Got it. Okay, we've got a caller from Compton, Noon. Good morning, Noon.
Hey, how you doing?
Good. What's on your mind?
What's on my mind is I wanted to just directly get right into it. When this first started, they told us, hey, nobody don't wear a mask. This thing is 5 microns. It's smaller than any mask. Only an N95 will stop it, right? So if we're to listen to the people that's telling us what's going on, CDC and our government, then we do what they say. So we didn't wear a mask. Next thing they told us was spray everything and wash your hands. Booyah. We're ready to do it.
Okay, I need the short version, because if you're going to take me through all the iterations, we're going to be here all day. Okay.
I'm going to give it to you real short.
Okay.
Wash your hands, do all this stuff. There is no Lysol. There is bleach now, but there's no Clorox wipes. There's nothing. So what are we washing our hands with? There's no N95 masks. They're all gone somewhere. What are we protecting ourselves with? A T-shirt? So people are getting mad because people are not walking around with T-shirts on their face. We got Mark Ridley Thomas and all.
Okay, thank you, Noon. Thank you. I get the idea. Got it. He's overwhelmed. It sounds like he doesn't think anything works. He's, concerned about conflicting guidelines, coming out and, saying that washing your hands won't make a difference unless you do it with bleach. I don't know where to start with that, but maybe you do.
Yeah, I think there are several really important parts to what was raised. One of them is the issues of washing hands and not having available things like Lysol or otherwise. Soap and water works great. And I think the main thing is wash your hands regularly with soap and water. Avoid unnecessarily touching your face, because that's how you transmit it, is from your hands to your mouth or nose. So if you can avoid that, your risk is going to be very, very small. And as far as the evolving and changing messaging, he's absolutely right. That has been a problem and has been extremely confusing for the community. But I think people have to understand that this is a new virus, and we are learning along the way. And there was some period of time where we needed to ramp up the availability of this protective equipment in hospitals. So there was a big focus on the very high-risk healthcare workers taking care of the people. And then we learned about the transmission from people who had no symptoms. We didn't know about that before this study started to come out, and that's when we started recommending face covering. And it is important for people to remember that the face covering, which can be a cloth mask, it doesn't have to be a surgical or other mask, that's mostly to keep your secretions, your droplets, from going to other people. It might protect you a little bit for sure, but it's mostly to protect the other people that you're with. So I can only say that the evolving message has been a challenge for everybody, but we all need to continue to follow the science. And that's been the mantra, and that's what I would encourage the community to be patient with us, but continue to listen.
And Supervisor Mark Ridley Thomas, you brought up the idea that we need to be involved in these clinical trials for the vaccines. I'm sure Dr. Daar agrees, but that's not happening right now. We're seeing that African Americans, Latinos just don't want to get involved with this. And as you pointed out, are saying they probably won't take the vaccination once it comes. What would you tell us about that?
Well, let me weigh in at that point and say that, the whole notion, Dominique, of empowerment speaks to self-determination and acting in one's own best interest and in the best interest of one's family and one's community. And you've been at the Empowerment Congress. I mean, that's the whole theme of it. There at Drew, driving it as hard as we can. So some of this is a question of community engagement and community education, community empowerment. You can't separate that from the research. So I keep making reference to the assets in our communities, community-based clinics. They know what to do. They can guide people, build your trust in those institutions that have delivered for you. There's a new one on the scene with which Dr. Daar and I are involved, called the Lundquist Institute. It is doing high-quality, high-level research and driving toward patient outcomes. And Dr. Daar, you might want to say something about your work there, but an example will suffice. Sickle cell anemia, something that African Americans principally have known about for a very, very long time. The level of investment and research in that area was really trailing off when the King Hospital closed. The sickle cell clinic meant that people who were suffering had to suffer worse until the hospital was stood up again, and the outpatient center where the sickle cell anemia center is located, first rate. When it came back online, things began to move. Trust those who are investing in your health care. At the Lundquist Institute, they have a new pediatric therapy for sickle cell anemia for the first time in literally 2 decades. Right there in our own 2nd district will bless the entire world with a new pediatric therapy. So trust those who are delivering for you and showing the way. Keep your guard up. Do not follow anybody who say masks don't matter. That's nonsense, to put it mildly. The best science, as Dr. Daar has indicated, makes that abundantly clear. And so I just know that trusted messengers are going to make the difference, and we have to model it, and we have to execute it, and we cannot accept clinical trials that exclude diversity. That has to be at the top of the agenda. They said COVID-19 was for rich people, old people, white people and people of color had nothing really to be concerned about. Do you remember that initially? That
Yes.
was flat out wrong. And so we have to do better, and we can do better. Thank you, Dominique. Dr. Dar, tell us about the Lundquist Institute. What you're up to.
We just have a couple seconds here, Dr. Dar, so if you could give us the Cliff's Notes.
Yeah. So I know I think all really excellent points, and I feel we're doing this vaccine study that's about to start. This vaccine that's developed by AstraZeneca here in Los Angeles County at the Lundquist Institute at Harbor UCLA, at UCLA and USC. So we have a very wide range of LA County that's covered. We have all seen, my colleagues and I, our obligation is to make sure that we try to address people's concerns in advance to gain that trust. Frankly, the trust we gained amongst our HIV positive community that allowed us to move forward with the great treatments that we have today. We need to now do that again with this pandemic. And by doing that, we're really serving two purposes that were mentioned that are really important. One is we're making sure that these groups who are at the highest risk of developing severe disease are elderly patients, are communities of color, and are people who have other medical problems like diabetes and hypertension, that they're included in these trials so that we can make sure that this vaccine works in the people who need it the most. But in doing that, we also might be able to increase the number of people that once we have an effective vaccine available will be willing to take it. Because the supervisor makes a really important point. He said that even if we have an effective vaccine, there are people that would not want to take it.
Yeah,
so we need
we
to
have
be
to
getting
leave it
them
there.
in the studies and dealing it. Thank you.
Okay, sorry, the clock just doesn't always work with us. Supervisor Mark Ridley Thomas and Dr. Eric Daar, thank you so much for being with us.
I'll be back.
Thank you.
Indeed you will. All right, continuing straight ahead right after this.